Hey everyone out there, it's Roberto Miki again, and we've got another hand question of the week in our series of questions for medical students, residents, and fellows studying for the boards or in-training exams. Well, without any further delay, here's the question. A patient undergoes a repair of the ulnar nerve 30 centimeters from the tip of the small finger. At what time point will sensation return to the tip of the small finger? A, 1.5 months, B, 5 months, C, 11 months, D, 24 months, or E, never? Well, here's your chance to pause the video so that you can answer the question. Peripheral nerves regenerate at approximately 1 millimeter per day or about 1 inch per month. However, you must add a 1-month delay to any calculations you perform because the nerve takes a 1-month break. So for an injury that's approximately 30 centimeters or 300 millimeters from the end of the small finger, it will take approximately 300 days for that nerve to get to the tip of the small finger. 300 days is about 10 months. 10 months plus a 1-month delay equals about 11 months. Now, the other way or alternative way of calculating this is converting millimeters to inches. So 300 millimeters would calculate to about 11.8 inches. And that is about 12 months, and 12 months plus a 1-month delay equals about 13 months. But the answer closest to the calculations here would be C, 11 months. So the answer to the question is C, 11 months. Well, thank you everyone for watching. Hope you enjoyed it. Hope you learned something, and we'll see you at the next one. Remember to like and subscribe so you can help support this channel.